So what do I do? I'm a surgeon and I specialize in procedures that help people lose weight with surgery. I also take care of a lot of other surgical illnesses, such as problems with the gallbladder, the appendix, the hernias, and a lot more different kinds of surgeries. We can go to the next slide, please. So these are pictures of what weight loss surgery looks like. The first picture on the left is something called a sleeve gastrectomy, where we take out about 75 to 80% of the sleeve, 75 to 80% of the stomach, and you're left with just a sleeve. The other procedure on the right side is a bit more complex. It's called a gastric bypass. With both procedures, patients do very, very well. Next slide, please. So these are some before and after pictures of patients who've had surgery. My patient on the left, actually all of the patients here did very well, as you can see. But not only are they losing weight, but they're changing their entire lives. Their confidence, their health, their prospects, the way they think about life improves dramatically after weight loss surgery. You can tell everybody is kind of smiling on the before side, but on the after side, they're smiling a lot. You can just tell they're a lot more excited and a lot more happy about life and their prospects. Next slide, please. Now, what is this? We talked about gallbladders, right? So the gallbladder sits right underneath the liver on the left side. On the left picture, the gallbladder is the green thing right underneath the liver. On the right side is a picture of your actual gallbladder. This is a gallbladder that I took out from a patient. I opened the gallbladder, and inside you see there's a lot of stones and a lot of what we call bile. These normally help the body to digest food. But when you have all these stones, the gallbladder can become infected. And so that requires most of the time the gallbladder to be removed from the body. So this is an actual picture of a gallbladder I took out a few months ago. Next slide, please. This is a picture of a leg wound. A gentleman was climbing up his ladder trying to fix something in his house. He fell down and he had a big leg wound that required surgical attention. So I had to take him to the operating room, wash out his leg wound. Eventually that wound closed, but it took about a month and a half for the wound to close completely, but he's doing fine and he's back to regular life now. Next slide, please. Now, does anybody know what this is? It might gross some of you out a little bit. This is your colon. So a patient came to the hospital for an emergency operation and they were having a lot of abdominal pain. And what we had to do is we had to find out why they were having this abdominal pain. So we got something called a CAT scan or a CT scan. And eventually we found out that they had a hole or a perforation in their colon. So we had to go to the operating room and we had to remove the entire colon. When we removed the colon, as you can see, I circled on the picture, we found a growth. So in this particular patient, unfortunately, she had colon cancer. The colon cancer caused a hole in her colon, and that's why she had to come to the operating room to have her colon removed. Next slide, please. It's another gross picture, right? This is your small intestine. And the patient came to the hospital because they were nauseous and they were vomiting a lot. They had a blockage in their small bowel. So we had to go to the operating room and take out the small bowel that was causing the blockage.